Hello, everybody. My name is Lucy Henry, and I am one of the study leads for the Born in COVID Year Core Lockdown Effects, or Bicycle for short, study. I would like to welcome you to the second in a series of 2 webinars presenting preliminary findings from our study. This study is funded by the Economic and Social Research Council and hosted at City St George's, University of London. We also have 5 partner universities from across England. Today, we will be presenting findings from interviews with parents and caregivers who had a child during the first English lockdown. In the next hour, I will start by giving you a brief introduction to the bicycle study and then hand over to Becky Moss to take you through the caregiver interview findings. We will then have a response to our findings from the guest speaker, Ellie Atkinson, who is a parent of a child born in lockdown. We'll then move to the question and answer session, and this will be chaired by Nicola Botting, our other bicycle study lead. Please do ask questions in the Q&A space and vote for other questions. We will answer as many as we can. Finally, we'll move to a series of short audience polls and finish with a couple of closing remarks. So to start off, I will give you a brief introduction and background to the bicycle study. We had 2 main questions we were interested in answering. First of all, what were caregivers' experiences of early parenting with children who were born in lockdown? And we'll be covering that in today's webinar. We also had another important question, which was, did being born in lockdown affect talking, thinking, or motor skills of the children as they reached 4 years of age? And we covered that a fortnight ago in webinar 1. Why is this important? Well, we know that families who had babies born between March and June 2020 experienced unprecedented levels of disruption. This included to the later phases of their pregnancy, giving birth, postnatal care, and at least the first year of parenting. The sorts of experiences that were disrupted by limited contact with extended families, the closure of baby groups and recreational spaces, and also workplace changes and restrictions. So who is taking part in the bicycle study? Well, we are recruiting families, and by this we mean the caregivers and the children from all walks of life and from all regions of England. We have 3 groups. We have around 200 children and families in each group, and from these, we interviewed 20 caregivers in each group. The 3 groups are, firstly, children who were born before lockdown. These children were babies or toddlers when the lockdowns were imposed. We also have a group of children who were born in those strict dates I mentioned between March and June 2020, and these children and caregivers will be the focus of today's webinar. We are also collecting data on children who were born after lockdown, and these are all children who were born after lockdowns had been released in England in July 2021. So what types of information are we gathering? Well, we are interviewing caregivers about their experiences of early parenting, and we'll talk about that today. In the wider study, we're asking children to complete a series of fun tasks and games to assess their talking and thinking skills. We're also asking caregivers to fill in a series of questionnaires about their child's development. So it now gives me great pleasure to hand over to Becky Moss, who will take you through our findings today.
Thank you very much, Lucy. So before we begin the presentation, I'd just like to give the audience a content notice. The presentation that I'll be delivering contains written verbatim quotes from interviews with parents and caregivers. And some of the quotes include descriptions of distressing mental health experiences and other challenges during the pandemic. We've included this content because we feel it's important to represent parents' experiences in their own words and to illustrate the themes that emerge from the interviews, but please do listen with care. So we conducted 20 online interviews with caregivers of 4-year-olds born in the strictest lockdown. Most of them were women, but we also interviewed 2 dads. And the sample included a primary caregiver who was a grandparent and a mother from a same-sex couple. And our topic guide was broad for the interviews. We asked interviewees to reflect on their or their partner's pregnancy and antenatal care, their experiences of birth and postnatal care, and the broad effects of lockdown on themselves, their partner, their children, and their wider families, both during the restrictions themselves and subsequently ongoing impacts. So 4 themes emerged from the interviews, and we've grouped them in the table here with a column for each theme. And findings from all of the interviews are under peer review by an academic journal, which we will share when the paper is published. But for today, I've selected some key sub-themes which are in bold in the table. So the first theme related to children. And here I'm going to talk particularly about children's language and social emotional development. And the picture that emerged here from parents was quite nuanced. Some told us that they were concerned about their child's language or ability to manage their emotions, though most said that had resolved by the time they were interviewed when their child reached 4 years old. One parent said, "He does have some speech problems. I don't know whether that could be related to the fact that even when we went back to classes, you had to wear masks the whole time. So whenever we were out, I was in a mask, basically, and he didn't even think it was weird." However, other parents were confident that their child was doing well, reaching or exceeding milestones for their age and stage, and some even felt that the lockdowns had actively benefited their children. One parent told us, "We've noticed that his speech and his intelligence is far superior than I think it would have been had we not been in COVID. He was surrounded by adults for that entire first 2 years. So he's had a lot of adult conversations and he has a lot of maturity to him when I think he otherwise wouldn't have done." Moving now to the second theme, which was sources of perinatal and postnatal support. And first, I'll talk a bit about support from healthcare professionals. And unfortunately, most of the parents that we spoke to reported quite significant gaps in their perinatal and postnatal healthcare provision. But it's important to say that they didn't blame healthcare staff for these experiences, and they went to great lengths to recognise the extraordinary circumstances in which healthcare workers were being forced to operate. But that did lead to some very difficult experiences. So one mother told us, a health visitor, when she eventually saw one, said to her, she basically took one look at him and said, "He's lost significant weight. You need to go straight up to the hospital. He dropped below his birth weight. They call it failure to thrive. They may as well have punched me in the face. It would have hurt me less. I really wholeheartedly believe that if I'd got the breastfeeding support that I needed, we wouldn't have ended up in such a dire position." A further source of perinatal and postnatal support is usually partners. During the strict lockdowns, many parents were only allowed their partners to be present during their active labour, and partners had to leave immediately after the birth with minimal time for bonding with their new baby. And this meant that women in labour had to try to advocate for themselves in very difficult circumstances. And unfortunately, one father ended up missing the birth of his baby. In relation to partner support, one mother said to us, "I didn't feel I had a voice and I wasn't being listened to. And if my husband was present at the beginning, I know he would have been my voice. So you were very vulnerable, in labour and a lot of pain, and decisions were made for you, and you had to go along with it." A more positive picture emerged from a different source of support, which were other parent peers. And many people describe drawing comfort from people both online by joining apps like Peanut, and also in person when that was permitted. And one mother told us about her experience on the postnatal ward. She said, "I've never had such camaraderie with strangers before. It was very lovely to be in a room with people that just got it. One of the most beautiful moments was each of the women took it in turns to get out of their bed and check on one of the other women that was crying." We all needed that sort of release, and that was a really beautiful thing to be part of, even though it was all harrowing. Moving now to the third theme, which was the impact of restrictions. And I've chosen to focus particularly on the sub-theme of employment and parental leave. So a particular sorrow that lots of people we spoke to expressed was the suddenness of their maternity leave. The uncertainty around pregnant women's vulnerability meant that many people were immediately dismissed from work, either to work from home or beginning their maternity leave early. And people told us that they were grateful for this protection, but it was also a really deeply unsettling time. And here's a quote that illustrates that point. One person told us, "I was a teacher and I had a message saying, 'You can't be in work now.' It was really strange because I remember going to get my stuff and people seeing me, and literally I felt a bit like I have a contagious disease because people wouldn't come near me and they were just all saying, 'You need to go.'" And the impact of those restrictions continued when people returned to work after their parental leave. Somebody said to me, "I'd forgotten about it in the context of a workplace. So when I went back, I was really thrown. There were one-way systems going around our desks. You could only sit at every other desk. I bumped into someone and I was like, 'Oh, it's my first day back.' And they said, 'It's my first day back in the office since COVID, and I'm really nervous about being here.'" The fourth theme was around maternal well-being, and the most striking interview finding we saw was the deep and long-lasting impact that the lockdown had on maternal mental health, and for some parents on their decisions about the size of their family units subsequent to that pregnancy and birth. And I just want to remind you that although there was a broad prompt in our topic guide to describe their own well-being, the extent of these impacts for parents emerged organically and it emerged consistently. Talking of her mental health, one mother told me, "I had some really bad moments and I was really angry. My mental health check was over the phone, which was rubbish. And I understand that that's all they could do. And at least they did that. But I was also like, that's something you need to be in the room with somebody for. And you need to see how they're holding their baby. Like there's so much that's only coming with body language. You can say all the right things. Oh no, it's fine." I'm sure that millions of women have felt like this. I just felt very robbed of the community and the support. Another parent told us about that those restrictions impact on the decisions of the size of their family unit. She said, "I've got a 4-year-old. People go, 'Oh, so when's the next one?' And it's an intrusive question anyway. But my first response is always, 'I had a baby in lockdown. He's the only pregnancy I've ever gone through and the only labour I've ever gone through. I can't even fathom the idea of going through that again.' People say, 'It'll be different next time,' but you can't guarantee that." So the overarching picture from the interviews I've described today revealed a clear, compelling truth. Parents felt that their children had emerged largely resilient, but that they themselves carried some profound and lasting scars. And across the interviews, communication and connection surfaced as a central thread. Parents told us their connection with other people was disrupted during the perinatal period, and they urgently sought it out during isolation in any way they could, and that they also strongly desired the opportunity to finally tell their stories. We think the interview findings demonstrate how deeply these experiences were felt and how rarely they've been acknowledged. And it's a real privilege to be able to do so now. And I'll end with a quote from a parent which sums that up beautifully. She said, "I was really keen to talk to you, not just a bit of therapy for myself, I guess to finally voice it to somebody that cares. Maternity services in particular from 2020 just slipped under the rug. People say, oh, just forget about that. It's not had any profound effect. I know a lot of people that it affected their bond with their child, their mental health like mine, they're going back to work, their decision to have more children. It has been massively detrimental and we don't talk about it. I feel very bitter about the entire thing." Thank you. I will end that presentation there with thanks for listening from the wider Bicycle team. And I'd also very much like to acknowledge the 20 caregivers who shared their stories so openly and generously with us, and also to thank the 205 children and families who took part in this phase of the Bicycle study. And thanks to you for your attention and contributions so far. We plan to post a link to both of our webinar recordings on our website, and please do feel free to share that link with your colleagues, and do also sign up to our newsletter at the address there. And now it's a great pleasure to hand over to Ellie Atkinson, our guest speaker, for a response to our findings from her own perspective. Thank you, Ellie.
Thank you. I'm Ellie Atkinson. I had my first baby, Rosa, 2 weeks into the strictest lockdown in April 2020. And just to give a bit of context to that, when I arrived at hospital, there wasn't even a mask policy. It was that early on in the process. And now looking back, that seems quite bizarre because wearing a mask is so synonymous with the whole experience of COVID. But it was optional. I remember turning up and asking the midwife if I needed to wear one, and she just shrugged and said, who knows? I was also in hospital on a Thursday night, and I don't know if people remember, but that was when the clap for the NHS was happening. So I remember I was induced. So I remember being in my hospital bed and hearing the distant cheers and claps for the NHS as I was in hospital waiting to have my baby. It was a very strange and dystopian experience. I'd also been travelling to the hospital in the first 2 weeks of lockdown before I had my baby to have blood pressure tests. And it was just so bizarre driving around the very empty London streets and turning up at hospital and having to show a letter to prove that I was allowed to come into the hospital for these checks. So it definitely increased my anxiety around having a baby for the first time. In terms of my experience of giving birth in lockdown, my husband wasn't allowed into the hospital room until active labour. So he was just told to get on with jobs at home, which he was doing. He was halfway through painting a wall when he got the call from me to say, you've got to come now. And he did. He very did nearly miss the birth. He arrived just in time for the first push. And I believe part of that was nobody was there to advocate for me during my labour. I'm not one to make a fuss, and certainly throughout the early stages of labour, I wasn't making a lot of noise. And the porter who took me hurriedly to the labour ward the next day came to me and said, you were having contractions in the lift, weren't you? And I said, yeah. She said, but you were silent. And that's just me. And I strongly believe if my husband had been there, I would have had somebody to advocate for me. And this rushed part of my labour perhaps would have been a little bit, I don't know, more well managed. I'm not sure. Maternity leave for me felt very surreal. I mean, I think it probably is for a lot of people, and it's important for me to say that I suspect, and I will never know, but I suspect that I would have struggled with becoming a mum for the first time anyway, in or out of lockdown, because it's such a huge and overwhelming change that I just was not prepared for. But to go through it as part of a national lockdown was a very lonely and frightening experience. When I think back about my time on maternity leave, I have this mental image of me walking around the park with one other friend in the rain, and also this quite bizarre image of me doing a baby class on Zoom, and there were all these tiny tiles of baby faces on the screen, and we were doing the hokey cokey. So there was about 30 babies just being held and doing the hokey cokey towards the screen and back, and it was just such an odd moment. I found it very overwhelming and often quite sad, having to hold my baby up to the window so that she could meet her grandparents for the first time. As I've said here, I'm a special needs teacher, and I too was told to leave work about a week before national lockdown started. So I had no time to say goodbye to my colleagues or my children, which was very emotional for me. I had a very strong bond with my colleagues and the children that I worked with, and we'd been working up to a big transition for me leaving. Some of the children have autism, they find change difficult, and for me to suddenly leave was challenging for them, as well as the rest of the lockdown implications that were happening. And my maternity leave started on the 23rd of March, which was also the day the lockdown started, which felt really quite surreal as well. In terms of sources of perinatal and postnatal support, I don't know if you can see the screenshot here, but I was scrolling through my phone looking for some old photos recently, and I found this screenshot from the Waltham Forest health visiting team, and it reminded me that when Rosa was around 4 weeks old, I received a phone call from my health visitor to say that all of the health visitors were being redeployed, and she had no idea when I might be contacted again, that her 6 to 8 week check would not happen, and she could not provide me with any further details. She did give me a phone number as a kind of a last resort, but I wasn't able to access breastfeeding support or a weigh-in clinic, and certainly nobody to support any mental health problems that I was experiencing. And in the scheme of things, I thought that me struggling to become a mum for the first time really was nothing within the wider context of people who were going through very difficult and traumatic problems with COVID. I now have another daughter, Violet, who was born in March 2024, and that's been really interesting for me because she was born at almost the same time of year. It did take us around 2.5 to 3 years to really consider having another child. And it's been very healing having Violet, and has enabled me to process a lot of trauma that I didn't necessarily realise that I had around having Rosa in lockdown, because I was able to experience having a child out of lockdown and how wonderfully different that is, to be able to access health visitor support, to go to weigh-ins, to access mental health support, to access breastfeeding support in person rather than over the phone, which was how I accessed it first time around. I remember speaking to a volunteer mum on the phone who was able to try and guide me to breastfeed in the correct position, which is just not possible without being able to see the mum. I was able to go to baby classes again, which was just one of the most joyful experiences. I remember going to baby classes the second time around and crying at the vision of children, these babies just being able to touch each other, and women sitting next to each other and sharing their experiences, sharing their birth stories, being able to go for a cup of coffee afterwards, all of the things that I was not able to do first time round. And although I struggled first time round, it wasn't until I experienced it properly the second time around that I realised quite how much was robbed. And I think this quote, this millions of women who felt robbed of community and support, truly does sum up certainly how I felt around my experience of having a baby in that first and strictest lockdown. So in summary, becoming a parent for the first time is an incredibly overwhelming, uncharted transformation. But to do it at a time when the world felt so scary and unknown was incredibly frightening and bewildering. It's been a privilege to hear other people's stories and experiences, and it's been so healing for me to share so many elements of those stories and for me to process and come to terms with a lot of what I experienced. So I want to say thank you to the Bicycle Study for enabling me to do this.
Thank you so much, Ellie, for your really personal and moving experience that I'm sure has resonated with many people listening and watching this talk. So thank you so much again. So now we're going to move on to some questions and answers. Please feel free to put any questions or comments into the Q&A tab. Don't put them in the chat, please, because that's not being monitored. And just to highlight that you can be anonymous, gives you an option to toggle yourself as anonymous. So please make use of that function. So the first question we have is, were you surprised how keen parents were to speak about their experiences? And were there more parents that you were unable to have interviews with?
Yes, absolutely. I've worked on lots of studies that have included an interview element, and this is the first one where almost every participant in the wider study has expressed an interest in telling their story as well. If we'd had the resource and the time, we could probably amassed over 100 stories. So it really was unprecedented, the number of people who were very keen to talk to us. And I should also say that before I spoke to parents, I didn't know anything about their experiences. So it wasn't that we chose people who had difficult times. These were people who arranged a conversation with me and I knew nothing about them until we spoke. So yes, I think the picture is that there's scope for a much larger listening exercise here.
Thanks, Becky. And another question is, we've heard some of the difficulties and stressful situations that people were in. And maybe I can ask both of you, were there, maybe Becky first, but what positive elements did people report? Did they talk about anything that was good? I mean, a couple of them were mentioned, but any more?
Yes, one thing frequently was that once the new mother was discharged from hospital, fathers and partners tended to be able to spend more time with their newborn than they might have otherwise, so beyond their paternity leave. Not in all cases, depending on key worker status and things like that, but several people talked to me about feeling like they shared more equally things like getting up in the night, dealing with their older children, and managing those kind of early weeks and months. So that was one positive that emerged. Ellie, I'll hand over to you though. How about you?
Yeah, that's in line with my experience. My partner is freelance, as he was furloughed and so was paid to stay at home. So he was at home for 5 months, which was just incredible. And I'm so grateful that I was able to have him around during that time, because like I said earlier, I suspect that I would have struggled becoming a mum for the first time anyway. So to have him around was really special. And another thing for me to note, I think that having a newborn in this time, although it was frightening, and the fear of that newborn contracting COVID was obviously a very, very difficult and distressing concept, the option being removed, i.e. of going out and socialising, actually made things very straightforward for us as a family. We just stayed at home and were able to bond, just us, with our new baby. And very much, I don't really want to use the word newborn bubble because it didn't have that glow that I was able to experience second time round. But just for us to be at home with her and not feel the pressure to bring her along to family events and parties, or, you know, whatever it was, when we'd had a difficult, tired night, or we're just finding the experience so overwhelming and new, that was really beautiful, just to be in our home. And as she grows older, I often reflect, oh, imagine having a child of Rosa's age now in lockdown. That I suspect would be very, very difficult. And also, we were very privileged. You know, my husband was paid to stay at home. He wasn't going out. We weren't unwell. So we really were able just to soak up that time with her. So that was a very positive side of it for us.
Thank you. Yeah, and there's a lovely comment in the chat as well, just about saying thank you for opening up, Ellie. Found it very emotional, as I didn't realise how much this had impacted me. This person also had their second baby in 2024 at about the same time as the COVID baby, and the experience was worlds apart. So very similar to what you've been telling us. But since my husband worked all the way through, though, outside of the house, and my COVID son now struggles with emotional and social development, which does make me wonder if I had some PND at the time. So I don't know whether either of you want to comment on social and, you know, what you've noticed about social and emotional development, and whether that's affected, or, you know, whether you feel like your children are different.
I have something to say. Yeah, I would actually find that's in line with my experience with Rosa. She learned to talk young, and she's very articulate. I don't know how much of that is to do with just being at home with just me, and how much I was able to communicate with her in an adult grown up way. I'm not sure, but I would say she really does struggle with emotional regulation, and that is something we have seen from a young age, and that is still relevant now. She really does struggle to regulate her emotions, and I also wonder how much that has to do with her early experiences of how difficult I was finding the time when she was tiny. And also because the restrictions did carry on. They didn't just stop when she was a newborn. They were carrying on as she was, you know, growing and becoming more receptive to language. And yeah, that is in line with my experience, definitely.
Becky, did you want to add, or are you?
Yeah, thanks. I think a particular point that some parents found challenging was the shift to early years providers. So when their child started nursery, a lot of them described finding that particularly difficult because they had to hand their child over on the doorstep. They were only able to do a virtual tour. So they didn't necessarily create a relationship with the staff, and they weren't allowed to sort of comfort their child. So that was a phase that lots of parents found quite difficult. But I must say that many of them felt much more positive about the start of school, and felt that that had resolved itself by the time that I spoke to them.
Great, thank you. Yeah, and we've got another question here, which I can talk to as well, but Becky may want to say something. Do we know if the feedback will go somewhere to prevent this happening again?
Go for it, Nikki.
Okay, I'll go with that. Well, the good news is that we are really very keen, I was going to say, but it's better to say it's very important to us that this information does go somewhere, that it doesn't just sit in the background. And we're fortunate that quite a lot of policymakers, including government bodies in different countries, are really interested in our findings. So the first step for us is to publish the paper that Becky's mentioned, that's currently under peer review. That's a process that happens in scientific journals where people, other peers, other scientists, look at the work and make sure that it's all reported clearly. And then after that, we will be sending our reports to people who can make a difference, we hope, so that this doesn't happen again, so that people are, you know, much more acutely aware of the devastating impact that some of the changes made in early COVID have had. And it might not just be in relation to, you know, other pandemics. It might be in relation to other situations where changes are needed in policy. So yes, it's definitely on our radar. Thank you. And actually, I think that was the last question, Becky. Oh no, sorry, hold on one second. There is another comment, sorry, which is, my first child is much more needy and finds his emotions harder to regulate than my second son, born late 2022. So yeah, that's like you were saying, Ellie, I think, and very much like our first webinar found as a group overall that emotional regulation and behavioural regulation is something that's particularly been noticed by parents.
Can I also add that I had a very interesting conversation with Rosa's teachers in year 1 now, and I had an interesting conversation with her class teacher who just shared with me that the current cohort she's in is without any doubt, the hardest class she's ever taught. So I think that's also really interesting, and that's something I've heard other teachers also say about this current year 1 cohort.
Yeah, absolutely. I think there's a call really for more support and a change in understanding of how these children are as they go through their primary years, especially. Oh, great. Well, let me just have one quick check. Were there any parents who spoke about having a second or third child in lockdown and how that compared as opposed to their first experience of having a baby being born in lockdown?
Yes, there were. So lots of the parents I spoke to were first-time parents, and I think that probably reflects the fact that lots of first-time parents signed up to the main bicycle study. But there were some others who talked to me about the stark difference. I can remember one mother of 3 who had her third baby in the lockdown and said, it was just black and white difference. We couldn't do any of the things that I loved doing with the older 2. And it was a real sorrow because she knew that would be her last baby. And there's also from other cohorts, I've spoken to people who already had a child before the lockdowns and then had one during the lockdown. And again, they're able to contrast their experiences. And besides the parents who said they decided they didn't want to expand their family any further, there were some like Ellie who said, I eventually did take the plunge and have another child, and it's been a healing experience and a massive contrast. So we will probably do some writing around the contrast between those phases for families that we've spoken to.
Yeah. So there's a couple more comments I just want to read out because I don't want to miss anyone out. Somebody said, I had my third baby in lockdown. I was lucky I knew what I was doing, but still struggled with mental health. It was also exhausting looking after 2 other young children at the same time and submitting homeschooling work on a daily basis. I felt my youngest missed out as the attention was taken away from her. If it hadn't been locked down, the others would have been out of school and nursery, out at school and nursery. So I think that's echoing again a lot of the stories that you've heard, Becky. And then finally, I wonder if somebody said, I wonder if you can explore further about emotional regulation with this cohort. And I guess I'll pick up on that and just say that we're obviously in our other elements that we're doing in the study in terms of assessing the children and asking caregivers to fill in questionnaires. We're exploring that in detail, and we're going to look in much more detail about which children were perhaps most affected in that way and which children seem to be protected from that, and see whether we can unpick any differences across families and report that back again so that people know a bit more in future for similar situations. We're also hoping to follow the children up later as they get older, but that's to come. We're not sure if that will happen yet. All right, so I'm going to hand over now to you, Becky, to do some quick polls. We'd be really grateful for the audience if you could fill in these quick questions just to help us get some feedback on our webinar today.
Thank you, Nikki. I've just launched the first one, so it should appear on your screen now. So please tell us which of the challenging aspects of lockdown that we've talked about today resonated with your experience, and do select any of them that apply to your experience. We'll give you a couple of moments to do that because I realise there are quite a few options there. Thank you. So I'll close that first poll now. And the second poll is sort of asking almost the opposite question. Did any of the positive aspects that we've talked about today, either in the presentations or in the Q&A, resonate with you? And again, please select any that apply, but also tell us other things that we may not have heard about. Just add anything else that was a positive for you and your family, or your clients, your friends, whoever you want to sort of relate this to. Please put those in the Q&A as well. Thank you. And a final poll. We'd be really grateful if you could tell us whether anything that you've heard today has increased your knowledge. So please do select whichever option you feel is most appropriate for you. Thank you. Thank you very much for your votes. We appreciate that. And that brings us to the end of this second bicycle webinar on our preliminary findings. We're really grateful for your attention. Please do watch this space. We'll be reporting updates as often as we can. And thank you all very much for coming, and have a wonderful afternoon. Thank you.